This is incredible. Everyone should feel what it is like to feel this connected to everyone.
But this is like nothing you've ever experienced before, so.
Think it's as simple as ABC? Ketamine is not just a drug.
It's a crazy, amazing, beautiful, wonderful, intense, weird experience.
Time stopped. Every moment was feeling right around like 6 hours.
Ladies and gentlemen, we have a new favorite psychedelic!
First an anesthetic, then a party drug, and now controversial ketamines have gone full on mainstream, bro.
Like it got pretty gnarly, you know? I remember one time thinking, there's no way I'm gonna end up back in my chair in this therapist's office. I don't know how I'm going to get there from where I am.
A treatment for depression, anxiety, even suicidality. So how did we get from ERs to mood clinics? Ketamine's gone from operating tables to therapy sessions and straight into the headlines. Even Elon Musk admits to using it, be it legally and in small doses. But not everyone's convinced that it's safe.
Usually when we hear about ketamine, we are hearing about its benefits. We are hearing that it can help cure depression. We are hearing that it can help reduce or cure suicidality, that it can be used to treat PTSD. And indeed, all of that is true. In the appropriate clinical context, at the appropriate dosages, and given at the appropriate frequency, ketamine has proven to be a miraculous drug for some people, not all people.
Some call it a revolution, a mental health rebrand, now hailed as a miracle treatment for depression.
And when you think about the average amount of time that it takes for a standard antidepressant trial to work, it's 2, 4, 6, 8 weeks. For some patients, it can be an hour with ketamine.
Others emphasize the risks, reminding us that even experts still don't have all the answers.
Emergent therapies have some patients and doctors excited, but are still in early stages.
So before you buy the hype, what does ketamine actually do in the brain? And just as important, but often overlooked in the brain combo, what does it do to the rest of the body?
I'm vibrating.
Remember, its effects aren't just isolated up here. Before we get swept up in the benefits, let's not forget, no drug comes without side effects. This is the science, the story, and the big question. Is ketamine the future of mental health, or just another trip? If you are a returning viewer, do me a solid and give the video a like and a comment, because it's the easiest way to support the intern army that doesn't cost you anything. If you are new to the channel, welcome. Watch the video first, and if so inclined, give me a like at the end. And don't forget to subscribe with notifications so that you can be alerted when I post content about drugs that affect your body. Because I need you on my march to 1 million, bro. With that out of the way, let's drop into it. See what I did there?
Sometimes you need something that breaks the connection between your brain and your body so that your brain gets a break from your body in processing the information.
I think the best way to describe it is like I'm peering past the universe to sort of the true universe where everything is melting into each other or is one.
Let's start with a bit of history.
Here we go, ladies and gentlemen.
Ketamine was first developed in the 1960s as a surgical anesthetic, and it is still used today in emergency rooms, trauma care, and even veterinary clinics. I just reduced a broken arm on a 4-year-old earlier this week, where we used ketamine as the agent of choice for analgesia.
So you've heard it before, but ketamine is actually a horse tranquilizer. 1 gram is enough to knock out a horse.
What made it stand out is that it could sedate patients without suppressing breathing, a huge deal in emergencies and combat zones. By the late 20th century and into the early 2000s, ketamine took a sharp turn from the OR to the rave scene. It earned the nickname Special K, known for intense dissociation and trippy hallucinations.
So how is it that a drug that at one time was really just viewed as a street drug that was bad, is now being prescribed widely and has all this interest surrounding it?
Today, ketamine is being rebranded and researched as a fast-acting treatment for depression, PTSD, even suicidality, especially for people who haven't had success with traditional antidepressants. This is the major hole in mental health treatment that ketamine is trying to fill. The antidepressants we've relied on for decades, don't work for everyone.
Drugs that are designed to increase certain monoamines in order to treat depression only work in about 40% of depressed people that take them. And they have a lot of side effects.
And heads up, this isn't really in my orthopedic wheelhouse, so I called in some neuroscience backup. Here's the basic idea behind most traditional antidepressants. They're built on something called the monoamine theory of depression. The idea that depression is caused by low levels of brain chemicals like serotonin, dopamine, and norepinephrine. SSRIs are designed to boost these levels and send stronger, feel-good signals. But that theory, it's starting to show its age, because in many cases of depression, there's no clear chemical deficiency we can actually measure. Instead, newer research is pointing to other root causes, like stress-induced brain changes, circuit disruption, and something called neuroplasticity, the brain's ability to adapt and rewire. And even when SSRIs do help, they often come with a long list of side effects: dry mouth, weight gain, low libido, insomnia, and they can take weeks to kick in. That failure rate pushed researchers to look elsewhere. To test new antidepressants, scientists used animal models of learned helplessness. Basically, they'd place an animal in a container of water to see how long it would keep swimming before giving up. Dark, but informative. And when they tried ketamine, the results were quite surprising.
These animals would swim for their life for a lot longer. Ketamine is what's called an NMDA receptor blocker. So it has this sort of property of overcoming what we call learned helplessness, or a sense of helplessness, aka antidepressant effects.
So how could an anesthetic, a drug meant to sedate you, somehow give you newfound vitality? A will to live again? Make it make sense. Well, ketamine's effects depend largely on how it's given. Its uses range from full-blown anesthesia to mental health treatment, a wide spectrum driven mostly by dosage and delivery method.
It kills the response to pain, and at certain doses, it can bring you into deep planes of anesthesia. At lesser dosages, it can take you into transition points between awake and deeply anesthetized.
In clinical settings, ketamine is usually administered intravenously, intranasally, or intramuscularly, all of which allow for rapid absorption and fast onset. Recreational or oral use, on the other hand, leads to slower, less predictable results. At high doses, like in surgery or emergency sedation, ketamine works almost instantly, causing loss of consciousness and deep dissociation. But at lower doses, the effects shift.
And it's really that transition point between awake and deeply anesthetized, which we are going to call the dissociative state. That's the state that has most often been sought after or employed for the treatment of depression, suicidality, and PTSD.
In mental health treatment, these microdoses guide patients into an altered state, a bit like being out of body, but without full sedation. Like psychedelics, it can cause hallucinations and a temporary break from normal perception.
So at this stage, I'm pretty deep into the experience. I'm no longer really in the room. I'm on my journey and I just feel really calm.
You kind of feel this dissolution where you separate from your body. You realize that everything is so temporary. Once you know that, it's easy to transcend your fear.
Most ketamine treatments use low-dose IV, off-label, or the FDA-approved nasal spray, Spravato, always under medical supervision. The dissociative high, visual distortions, time warping, that floating detachment, kicks in within minutes and usually fades within 1 to 2 hours, fitting within therapy appointment times. These subjective effects are separate from the antidepressant benefits, which often kick in within 30 minutes to a few hours and can last days, even up to a week, much faster than traditional antidepressants like Zoloft.
What should I do right now? Just kick back and relax.
By now, you're probably starting to see why ketamine is such a promising option, but also why it carries real risks. A lot of people just want to feel pain-free in both body and in mind. So far, I've mostly told you what ketamine does. Now let's dive into how and why it's unique, both for rapid pain relief and boosting neuroplasticity. Time to hop on the magic school bus and take a trip inside the brain. Let's keep it simple but scientific.
So we think that we're actually targeting a different system in the brain than typical antidepressants are targeting. And that may be why ketamine works so well even for patients who have not had success with a number of different standard antidepressants.
First off, scientists still don't fully know exactly how ketamine works. There's no single answer because it really hits multiple systems at once.
Ketamine is what scientists call a dirty drug. That means it doesn't just target one system in your brain, but dozens.
One of its biggest targets? NMDA receptors.
The blood-brain barrier keeps a lot of things out of the brain, but ketamine can very readily pass across the blood-brain barrier. Once it's in the brain, it has a very high affinity for, meaning it knows how to seek out and bind to those NMDA receptors.
These NMDA receptors are docking ports for glutamate, the brain's most abundant excitatory neurotransmitter. Basically, the chemical messenger neurons use to talk.
Glutamate is what many of the neurons in your brain use to communicate with each other. And without it, well, your brain would essentially shut down, like a city grid without power.
There are two main neuron types: excitatory neurons, the brain's chatterboxes that release glutamate saying, hey, and sending a go signal, and inhibitory neurons, the library kids, which release neurotransmitters like GABA to say, shh, stop, or slow down.
There are essentially two major types of neurons in the brain. You have those excitatory neurons, meaning neurons that when they are activated electrically, they activate or excite other neurons. The other major type of neurotransmission in the brain is called inhibitory neurotransmission. When GABA is released, it has the property of reducing the probability that the next neuron will be electrically active. In fact, GABA's job is to bind to receptors on the next cell and to make it less electrically active.
NMDA receptors are mostly found on the excitatory neurons, but they also hang out on some inhibitory neurons, kind of like double agents working for the glutamate system in a somewhat counterintuitive way, which we'll get into soon.
Get this. He was a double agent.
Normally, without ketamine, these NMDA receptors stay quiet under everyday conditions. But when you're learning or facing challenges, they help the brain adapt by supporting neuroplasticity. Ketamine acts as an NMDA antagonist, blocking these receptors and preventing glutamate from binding. But wait, if ketamine blocks NMDA receptors, shouldn't that reduce plasticity?
It prevents neurons from being as active as they normally would be, and yet somehow, almost paradoxically, it increases neuroplasticity in brain circuits that are involved in mood, in reward, in self-reflection.
Here's the thing. Ketamine works its magic by binding to those inhibitory neurons, the double agents, essentially cutting the brakes and unleashing rapid bursts of excitatory activity. This sparks neuroplasticity by strengthening neural connections and making them more likely to fire again. It's like a power surge firing up the brain's mood circuits. This sudden shift seems to help the brain process emotion and stress in new ways by unlocking stuck or dysfunctional brain pathways.
When people are stressed for a long time, or when they suffer from depression for a while, they start losing these connections.
It's a microcosm of what happens in a depressed person's life. Social connections fade, people disengage, and even simple tasks feel overwhelming. The same thing happens inside the brain. Ketamine appears to have a regenerative effect on this brain circuitry.
We think that one of the things that ketamine does that helps to explain its antidepressant effects is help the brain to regrow the connections between nerve cells.
Another mechanism behind ketamine's effects, a major player called BDNF, brain-derived neurotrophic factor. Many scientists call it miracle grow for your neurons. It helps brain cells grow, connect, and repair themselves, again boosting neuroplasticity. Dr. Huberman and other brain researchers believe this might be central to ketamine's antidepressant power.
Ketamine-induced release of BDNF is one of the core mechanisms by which ketamine can relieve depression. The insertion of new glutamate receptors so that those neurons become extra sensitive to any input they get. It can cause neurons to grow new branches so that it can receive new inputs from other neurons.
Some researchers even think ketamine might mimic BDNF directly, basically acting like a growth factor in the brain. That's extremely rare and a big deal. And this isn't just a theory. In stressed animal models, ketamine didn't just make them behave better, it caused measurable regrowth of dendritic spines in mood-related brain regions.
One of the things that's regrowing are the integrity of the inputs to a nerve cell, the regrowth of those dendritic spines, the regrowth of those synapses.
Dendrites are like the input branches of a neuron. The more healthy spines it has, the more resilient your brain can be. In that study, mood effects started within a few hours, but structural brain changes like the growth of new synapses took closer to 12 to 24 hours. So while it is still quite rapid, neuroplasticity isn't instant.
It is happening over the course of at least many, many hours, and more likely many days or even weeks.
And scientists believe those structural changes are essential for long-term recovery. Ketamine doesn't just flip a switch, it opens a window.
We think that this may open a critical period where now the brain is more plastic, both at the cellular level, but possibly even at the functional level, where we can start to work to change people's reference of thinking or their ability to respond and adapt to new social or environmental stimuli.
That window gives people access to new perspectives and behaviors that felt impossible before. It's that altered, but yes, very freaking high, state that sparks the ignition, a breakthrough that continues to unfold. Ketamine also activates brain regions like the prefrontal cortex, amygdala, and hippocampus, all crucial for mood regulation, memory, and emotional control. Take the prefrontal cortex. It helps you choose strategies, weigh consequences, and stay on course. But in depression, this system gets foggy. People get stuck, unsure, or indifferent. It's not about willpower, it's brain wiring.
It makes people more sensitive to whether or not they are getting the results they want from their efforts, and to how to adjust their efforts so that they do get the results they want from those efforts.
With ketamine, what we're doing is pinging the brain, triggering the brain's resilience mechanisms to promote the maintenance of healthy circuits in the brain.
For someone in the depths of depression, that shift can be life-changing. It turns passivity into possibility. Challenges now become overcomable. That's the real promise of ketamine.
There's still a lot we don't know.
He says that because ketamine manipulates so many different receptors in the brain, it's been hard to nail down all of them. So it's still unclear how it might affect different patients, both short and long term.
So before we get carried away, who actually gets ketamine? Because let's be real, whether you think the mental health crisis is underdiagnosed, overdiagnosed, or just part of the cultural conversation, more people than ever are being told they have depression or anxiety. Sometimes it even feels like it's becoming a trend. But ketamine? It's not a first-line treatment. Leading psychiatric researcher Dr. John Crystal explains.
Reserved for people who haven't had an adequate response to at least 2 prior trials of antidepressant medication.
The antidepressant effects of ketamine appear to be fairly short-lived, at least when one is exploring 1 or 2 treatments with ketamine.
But when used consistently under supervision, ketamine appears to rewire brain circuits, producing benefits across short, medium, and long-term timescales. Still,
we know that we cannot give it every day. That's like substance of abuse, because then it will harm the brain.
Because ketamine affects so many brain systems and is still an anesthetic at its core, researchers don't fully understand how to sustain its antidepressant effects without risking tolerance, dependence, or long-term damage. Okay, so far we've talked a lot about ketamine's effects up here in the brain. But it doesn't stop there. Ketamine's effects vary by location and dose, and at slightly higher than microdose, but still sub-anesthetic levels, it blocks excitatory neurons in the spinal cord, interrupting pain signals before they reach the brain and reducing the sensation of pain. And surprisingly, ketamine also interacts with the body's opioid systems.
But ketamine can also bind receptors in the opioid pathway. When opioid receptors are bound, we know that creates certain effects. Things like pain relief, things like changes in psychic states. If enough of them are bound, you can get euphoric states.
Then there's inflammation. Early research suggests ketamine may reduce pro-inflammatory cytokines, the chemical messengers that drive both physical pain and mood disorders. It's still early days, but this could be another piece of the puzzle behind its broad therapeutic potential. Unlike most anesthetics, ketamine doesn't cause full body paralysis. Patients can still breathe on their own and even move a bit under sedation. population. That's why it's used in field medicine and emergencies, though those movements can get a little weird. Some patients experience balance issues, altered body awareness, or temporary coordination problems right after treatment. It messes with proprioception, your internal sense of where your body is in space. That's why ketamine shows up in some DUI cases. Even if someone seems awake, their reaction time and motor control can be impaired. And in long-term recreational users, it gets worse. Distorted gait, clumsiness, and even lasting proprioceptive issues.
I've expanded my mind. I can see visuals, things trippy as f, and it's great.
But to be clear, in clinical settings, these effects are temporary and closely monitored. No one's being sent out to drive mid-K-hole. But all drugs have side effects. Common short-term ones include nausea, dizziness, blurred vision, muscle stiffness, and that dreamlike dissociation. Some people get increased blood pressure or feel off balance. You might also see strange eye movements, confusion, or hallucinations. And for some, the experience is euphoric. But for others, pretty freaking terrifying.
Because we're talking about a drug that has a lot of different effects depending on the dosages. Individuals vary tremendously in their response to different dosages of ketamine.
In rare cases, people can have serious reactions, breathing issues, allergic responses, or psychiatric flare-ups, like mania or psychosis.
People who have the diagnosis of schizophrenia, so far, we would not recommend.
And that's just in the clinic. In the emergency department, I have seen some of these side effects myself when it has been used for procedures. Recreational use is another story.
I just want to apologize for going into a K-hole in front of you.
I'm sure you're all familiar with a K-hole.
What that means is that they took a dosage that for them put them beyond the boundary of the sub-anesthetic dose and has them transitioning into the anesthesia level dose of ketamine.
Sometimes that's fatal.
Your client very well might keel over and just die in the sand here.
Especially when combined with other drugs.
Friend star Matthew Perry died from the acute effects of ketamine. His last known treatment was 1.5 weeks before his death. The ketamine in his system could not be from that.
That happened to someone who regularly used ketamine therapeutically. But the dose that killed him wasn't from a medical facility. That case is a sobering reminder. Ketamine can be deadly when misused or taken unsupervised. Clinical treatments come with strict monitoring, trained staff, and emergency protocols. Even minor pre-existing conditions or lifestyle factors can spiral into serious complications. As access expands and use becomes more common, there are pros and cons to consider. Take the UK, for example, where ketamine isn't legal medically. It's still a real problem, especially amongst young people.
People used to sit in a pub and done drugs socially where there was a bag of cocaine and a pint on a Friday night. Now it's a bag of cat and a pint. And it's definitely more the younger scene bringing it in, like from probably even as low as 16 to maybe late 20s.
Doctors started noticing when many young patients showed up with severely damaged bladders, a major physical side effect of ketamine abuse.
Actually, about 1 in 4 people who use Ket will have bladder problems as a result. And some addicts completely lose control of their bladder because of it.
In just a few months of daily ketamine use, he nearly lost the use of his bladder.
This level of harm usually stems from chronic heavy abuse, not a single trip. And often, these users are self-medicating untreated mental health issues. So, could legalizing ketamine therapy help curb its street misuse? Potentially, but it also opens the door to a blurrier line between medicine and overindulgence.
And it is a drug that nowadays there is crossover between the clinical uses of ketamine for treatment of depression, etc., and its recreational use. What I'm referring to is people accessing ketamine legally, but taking that ketamine out of the clinic, out of the doctor's office.
It's a pop culture meets public health moment. From stigma to normalization. Should we be worried? Ketamine is already offered at private wellness clinics across the country, often catering to wealthier patients and marketed as quick mood resets, sometimes with minimal oversight or follow-up.
So that's why I wish that there had been more, before I went in to get it, that I had had more of an understanding of how to navigate the universe a little bit and how to use the experience.
This raises important ethical and public health questions. Who has access access? Is it only for the wealthy, since it's not usually covered by insurance? Do patients truly understand the risks, or are they just told it's a miracle fix? And are these treatments properly guided by mental health professionals or treated more like spa services? When introducing any new drug treatment, we must double down on prevention. Positive habits can't be replaced. While some with depression struggle to take action, as ketamine becomes more normalized, especially in our quick fix culture, we have to be careful it doesn't become an excuse to avoid lifestyle changes. Not saying this happens all the time, but I am seeing a strange social contradiction. Even highly religious or conservative communities sometimes embrace ketamine while rejecting other medications or substances.
I'm very interested in how ketamine therapy sort of squares with Mormonism.
It's so funny. I always say it's like a Mormon loophole. Like, since it's a doctor and it's like
not
medicated.
recreational.
Yeah, they're not doing it on their own. I think it's like how they get away with it. Like, I can go do drugs, but it's like therapy.
Exactly. Ketamines are seen as a clinical workaround. It's seen as a clean therapeutic exception, not a drug. But that can turn into a way to band-aid over deeper issues, chronic stress, burnout, or emotional repression without actually addressing them. Yes, antidepressants can help stabilize someone long enough to make change. That's the point. But they're still only a crutch, and you still have to do the rehab.
They are also starting to do other things. They are going back to work. They are engaging in relationships again. They are viewing themselves differently again. Hopefully they're getting morning sunlight and exercising and eating well and doing all the sorts of things that we would call antidepressive behaviors.
As Dr. Huberman explains, biology and behavior go hand in hand. Ketamine may reduce inhibition in the brain's dopamine reward pathway, making it easier to engage in everyday activities. But neural activity alone won't cut it.
That a discussion of neural circuit changes in response to ketamine is really a discussion of neural circuit changes in response to ketamine that shift one's overall system toward having yet further neural circuit changes in response to daily activities and thereby bolstering health.
So yes, ketamine can be less numbing than daily SSRIs and often work faster, but regular use without reflection can delay real healing.
We've been very interested and very active in pursuing ways of using other ancillary therapies like cognitive behavioral therapy to actually work with the patient to not only have them feel better, but to develop new ways of adapting and having new cognitive strategies.
But with the right support and used intentionally, ketamine can act as a catalyst, creating the conditions for real change.
To try to make sure I was very intentional about the goals I had, and it was really paying off. I found just incredible clarity as we're going through. The actual experience is feeling super safe, super calming. The exact mixture of the music playing and that preparation is creating a pretty profound, transformative experience for me.
That said, it is not a miracle drug.
I don't think that there is any compound that alone can produce all the desired effects that one wants without any negative effects in a way that could warrant calling it a miracle drug. That's just not how biology works. There's always an interplay between pharmacology, between our behaviors and what we choose to do or not do.
And like any drug, context, supervision, and moderation matter.
This is not a DIY type of thing. This isn't let's look online and go for the cheapest or the closest location.
This isn't really something to self-experiment with. It demands responsibility, both from individuals and the medical system promoting it. Because at the end of the day, the biggest risk isn't ketamine itself. It's using it without understanding what it really is and what it isn't. Thanks for joining me in this discussion about the effects of ketamine use and abuse. If you want to get smarter about topics like this where human anatomy and injury science intersect with current trends and pop culture, join the Intern Army and click on notifications to catch my uploads every Monday morning. And if you dig what I do and want to support the team even more, consider becoming a member of the channel. And don't forget to follow my gym, Human 2.0 Fitness, for free right here on YouTube, where we post content that helps you move better and prevent injury, or its sister channel, Human at Home, where we show you how to be healthy in the space where you live. Otherwise, as always, that's been a word from Dr. Chris Raynor, not your everyday ortho, where we see one, do one, teach one.